Hi, this is Dr. Hines coming to you again. I know it's been a while, but we've been a little bit busy with some new projects that are coming out that I'll tell you all about a little bit later. But in the meantime, this is the office. And you can see there. So hi, I'm at work today. Just wanted to do a quick video. People have been asking me, should I still come to the emergency room even though, we are experiencing a pandemic and have the shelter in place orders and such things. And so the short answer to that question is absolutely. If you are experiencing what you feel to be a medical emergency, you most definitely should come to the emergency room and be evaluated. There are still medical emergencies that are happening. People are still having heart attacks, people are still having strokes, people are still having pneumonia and the like. And so those things require medical attention sooner than later. One of my concerns is that because of fear of COVID, people have been staying at home with very severe conditions, and those conditions have worsened and people have had bad outcomes, including death, unfortunately, because they have been afraid to come to the emergency room. So you're hearing it from me. Many of my other colleagues have been saying it as well. You do not have to be afraid to come to the emergency room. We want you to come to the emergency room and seek medical attention if you feel you are having a medical emergency. Which leads to the next thing. How do I know that I'm having a medical emergency? Well, I've compiled a list of about 11 emergent conditions that would require care in the emergency room. So I'm going to pull up my little cheat sheet here and just read it, even though it's off camera so y'all can't see it. Little camera trick, I guess. So if you are experiencing chest pain, shortness of breath or breathing difficulty, severe headache, bleeding that won't stop, severe abdominal pain, nausea and vomiting that won't stop, of course, any traumas. And so I'm not talking about accidents where, of course, an ambulance would bring you to the emergency room, but even traumas that happen at home, slip and falls, where you can't get up or you have, deformity of a limb or something like that, of course, come to the emergency room for that. If you have any syncope, which is passing out or losing consciousness, seizure, any sudden onset of weakness or paralysis, difficulty with speech or confusion, those may be signs of stroke, and most certainly we want you to come to the emergency room for that. Of course, if you're having any severe allergic reaction symptoms, for example, an extensive rash or hives, severe itching, any tongue, lip, or throat swelling, most definitely come to the emergency room. So all of these 11 common symptoms that we see can be symptoms of a life-threatening emergency situation. So you should come to the emergency room. I tell people that the risk of a bad outcome from having some of these symptoms is far greater than the risk of contracting COVID. So the question, should I call the emergency room first? My opinion, no, you shouldn't. Because in my many years of doing this, I've never heard anyone giving medical advice over the phone. What we are going to tell you is some line to the effect of, quote, if you feel you are having a medical emergency, please come to the emergency room. We are never going to tell you, oh, just try this at the house first, or something like that. That's just not what we do. So overall tips, you want to use your best judgment. It is better to be safe than sorry. I always tell people that if you come to the emergency room and you get discharged and there's nothing wrong, that's great. I would rather you come to the emergency room and me tell you that everything is okay than you to be at home and everything is not okay and you don't have anyone there to help you. You always want to wear your mask and practice your social distancing. And of course, we are in many emergency rooms across the country. We are doing that where all of us wear masks, and we are requiring patients to wear masks. We're restricting visitors just to decrease those potential exposures, of course. You want to continue to take your medications as directed by your physician and pharmacist. You want to continue your routine follow-ups with your primary care physician. And if you are experiencing any emergency symptoms, please don't wait. Please come to the emergency room as soon as you feel you are experiencing these symptoms, because we know that early intervention leads to better outcome. This has been a little medical minute tip with Dr. Carissa. Thank you so much. Be well, be safe, and we'll get through this because we're all in it together. Bye.